This week in Health and Science News, the FDA-NIH Rare Disease Day was postponed. This is a conference that brings together patients that have rare disease, their caregivers, and researchers, and helps to promote rare disease research and product development. So there is no date as to when it's going to continue, and it's definitely a loss for the rare disease community. The FDA unexpectedly canceled a meeting of its advisors to update next season's influenza vaccines. Companies rely heavily on the FDA to pick out the strains that they will use in shots for this fall. Individuals on Medicare may have some of their telehealth privileges revoked at the end of next month. Congress, towards the end of last year, extended the COVID-19 flexibilities that were put into place that expanded telehealth coverage until March 31st. So it's up to Congress to extend them further or actually put this into law. Republican senators introduced a bill that would add work requirements for Medicaid. It was introduced last week and would require able-bodied adults without dependents to work or volunteer for at least 20 hours per week to receive Medicaid benefits. In extremely sad news, in the outbreak of measles in Texas, one unvaccinated child died and 20 others have been hospitalized. JFK Jr.'s immediate response to this news of the death of a child from measles was to say such outbreaks are a commonplace event, and also said that hospitalized patients were being kept mainly for quarantine reasons. This is completely false information. Measles was eradicated in the United States back in the 2000s, but due to vaccine misinformation and apprehension from parents to vaccinate their children, we now have been having more and more outbreaks. So please get vaccinated and make sure that your measles titers are at the level that they should be if you have been vaccinated. That's it for this week's health news. I'll see you next week.